There are three basic modalities that we use to image the brain in neuroradiology. The first is CT, or computed tomography, and with CT we're using X-rays to image the brain by analyzing the imaging with advanced computer systems. That allows us to acquire individual slices, and it's an excellent way to look at bone structure, to look at the brain parenchyma, and to evaluate for intracranial hemorrhage. The second, and probably the more common way that we use to image the brain now, is with magnetic resonance imaging, or MRI. MRI has been around now for about 20 years or so. It provides better tissue resolution than does CT. It does not use ionizing radiation, which is an obvious advantage, but it does take a fair amount of time to acquire the imaging, and so it may not be appropriate in a particular clinical setting. And it is not as sensitive to the detection of blood products as CT is, and so if we're concerned about hemorrhage, we may prefer to do a CT rather than doing an MRI. And the decision as to whether to perform CT or MRI depends a lot on the clinical question and the status of the child when they present to us. So it's often a discussion between the clinician and the radiologist as to which is the preferred modality at the time. The third technique that we use fairly frequently is cerebral angiography, or catheter angiography. And with catheter angiography, we're placing a small tube into the artery in the leg, passing that up into the blood vessels in the neck, injecting dye, and taking pictures under X-ray. That allows us to look very specifically at the blood vessels, to get a timing sense of the blood flow between the arteries and the veins, and to give really high definition anatomic detail of vascular structures.